I knew it was going to lead to surgery as soon as I saw it. I mean, there was just no way conservative measures were going to provide any long-term relief. Symptomatically, I was just getting worse and worse. The pain was not just confined to my back, it was spreading down into my left leg. It was really affecting my mobility. It was affecting my ability to round on my patients in the hospital. I noticed it after doing several cases, and at the end of the case my back would be a little stiff and sore, which was not unusual, but this persisted. This would not resolve after a weekend of rest, or it would not go away after a good night's sleep. It simply persisted and worsened over time. And I would say over a 4 to 6 week period of time, really progressed to the point where it was constant. It was not going away. Ultimately, yes, I did get the MRI, and that's where I saw that I had a grade 1 L4, L5 spondylolisthesis, severe compression. I was being pushed around by my nurse practitioner in a wheelchair in order to make it through the hospital to see patients. I could stand for short periods of time while interacting with them, but anything longer than several minutes on my feet became extremely difficult. Obviously, standing in the OR for extended periods of time became extremely difficult, so I really started performing surgeries while sitting during that period of time. But it really impacted my flow. It impacted the way I ordinarily practice medicine, the way I see my patients in the hospital, the way I operate, perform surgeries in the operating room, and so my life, to say the least, was significantly impacted. I had become familiar with Premia and TOPS even before my symptoms started. I had worked to get it approved here at this facility because I really wanted to start to implant them in my patients. But I knew that as soon as I saw my MRI that's what I wanted. I did not want a fusion. I did not want the more traditional route. I knew what I needed to get done, and I really needed to get back on my feet as quickly as possible. There was an individual that works in our operating room who had worked with Dr. Beckman in San Antonio, and this person knows me pretty well and said, you know, Dr. Beckman reminds me of you, the way you operate and the way you care for people. So that was all the recommendation I needed.
I had the rare opportunity to operate on another neurosurgeon. And not only was it another neurosurgeon, it was another neurosurgeon who actually performed the TOPS procedure on someone. And when you get that phone call, you actually get really excited. In my practice, I operate on a lot of physicians. For whatever reason, I think that we just communicate well and we have a lot of trust.
The more I talked with Dr. Beckman, the more I was adamantly convinced. I guess it's sort of a sixth sense type of feeling that once I meet someone and talk to them, that I know that this is the person that I trust, that I would say, yes, absolutely. It was a fairly uncomfortable few days, but it was more surgical. In fact, it was all surgically related. It was not related to any of the preoperative painful symptoms that I was experiencing, which was immediately evident upon waking from the surgery. Even on post-op day 1, I was definitely not, unfortunately, following Dr. Beckman's advice and limiting my activity. I was pretty active even on post-op day 1, traveling with my son, going through Denver and going out and about, but I did notice immediately that I could stay on my feet. I did not have the left leg pain that I was having before. The numbness and tingling on my feet were so much improved, so a lot of those types of symptoms were immediately evident. Going home the first day after surgery and ambulating so well and just feeling so great and not being dependent on pain medications even so soon after surgery, I knew that's what I wanted for myself as well. And honestly, having gone through that post-operative experience and having had that exact same experience where instantaneous pain relief, not being dependent on pain medications for more than a day or two, and the physical, the release of physical limitations was just amazing. So I'm so incredibly grateful for that. I was operating on post-op day 10, so I went back to work. And I don't know if this is a good thing to admit or not, but probably about post-op day 9 is when I first showed up to work to go to see patients in clinic, and I had surgery scheduled on post-op day 10, and they went incredibly well. It was such a pleasure to be able to stand during surgery and not have to worry about sitting down or taking frequent breaks because my back and my leg were hurting so badly. I had every expectation that I would get better, and I did. And the way I got better was the way I had hoped and in a way expected, because I had seen it happen so frequently, or I had seen it happen universally in the patients that I had treated thus far. And in the time since my surgery, I believe I've done a lot more implantations of tops, and I can't think of a single one who has not done incredibly well in terms of return to function, return to normal activities, getting off the pain medications, getting back to their normally physically active life so soon after surgery. I think is the greatest blessing of all.